Story time about this elderly patient who was traveling from Jamaica and collapsed in JKIA while transiting to Kruger National Park in South Africa. So he was with his family. He had just beat cancer and had been cancer-free and stable for 6 months. And his kids were like, why not? We're treating our dad to Africa Safari. So while connecting Addis Ababa, JKIA to South Africa, he collapsed. He collapsed in JKIA, while leaving the plane. So they stayed, tried to help him, and then they put him into an ambulance and they came to Aga Khan. And it was on a Friday. We were just finishing the morning clinic, and my boss had gone out to the cath lab. So I was winding up. So this patient was brought in. They bypassed the emergency room because they just wanted us to sort him once and for all. So I talked to him. They gave me the story of their journey from Jamaica to where we were at that point. And they told me that he had just beat cancer and he was being treated to an African safari. So I did an ECG. It looks a bit abnormal. And I actually almost discharged him. I almost told him, it's fatigue from your journey. You just continue to Kruger. But something told me, you better put a probe on his chest, an echocardiogram. Just look at how that heart is. And so I put a probe like this. Luckily, in the cardiology training in Aga Khan, they make sure that you are very good in doing echocardiograms independently, so that if you're called at 3 a.m., you're able to do an echo without disturbing anybody. So I took him into the echo lab and I did the echo myself because, the echo technicians were on lunch, and it's so easy to do an echocardiogram. When I put the probe like this, the right ventricle was huge. Now, normally, the right ventricle is not supposed to be big. It's supposed to be smaller compared to the left ventricle. But the right ventricle was bigger than the left ventricle. That's a red flag. And one of the commonest conditions that can give you that is a pulmonary embolism, meaning blood clots in the pulmonary trunk. The pulmonary trunk is the artery that takes blood from the right ventricle into the lungs for oxygenation. Now, when there are blood clots on the pulmonary artery, the right ventricle is forced to work under pressure, and that makes it balloon out. Okay? So I told them that I was suspecting the patient to be having pulmonary embolism. They were in a hurry. Their next flight was at 6 p.m. and this was 2 p.m. And international flights, you have to check in 3 hours before. Yeah, so I had to tell them, my suspicion is pulmonary embolism, and I need to make sure it's there or not there before I release you to continue on the journey. So in Aga Khan, the way we've been trained, if you're a trainee, you see all the new patients independently, and then now you discuss with the consultant one-on-one. So I called the consultant. Hi, Dr. Ngunga, I have these patients like this and like this. The RV is huge. It's like, yeah, let's do CTPA. I better do CTPA. So I sent him for a CT pulmonary angiogram. CT pulmonary angiogram is the one that will help you to confirm the diagnosis. The echo just helps you to suspect, but the gold standard is the CT pulmonary angiogram. So I sent him for CT pulmonary angiogram. They were grateful that, I was trying to be helpful, but at the same time, they were just wishing they could just continue to Kruger International National Park. CTPA confirmed pulmonary embolism, and now I had to tell them that we are canceling their journey because we needed to admit them to come in to the ward so that we start blood thinners. In Aga Khan, if you're diagnosed with pulmonary embolism, you have to be admitted. Most of the time, you'll be admitted to high dependency unit, and this is because pulmonary embolism can complicate. You can get what is called massive pulmonary embolism, meaning the blood clots are so huge, it's making your heart to become unstable and making your heart not to work well. You can go into shock. And so in case you need a clot buster called thrombolytics, then they need to intensively monitor your blood pressure, your oxygen level, your heart rate. If the blood pressure starts to go down and the heart rate starts to go up and the oxygen level go down, then they'll prepare to give you thrombolytics. So they were, that wasn't good news to give to them, but they accepted because there was no option. So they were admitted, they were treated luckily he didn't need thrombolytics, he didn't need a clot buster, so we just gave him blood thinners. He was with us for 5 days. He became better. That feeling of dizzy, some discomfort went away. He was discharged. Then he was basically stuck in Kenya for 2 weeks, but so grateful because blood clots, pulmonary embolism, blood clots in the lungs and the pulmonary trunk can be life-threatening. And I'm sure you've heard of people who die up in the plane, just die because in a pressurized cabin up when your plane is up in a commercial plane, things change and you get worse if your heart was compromised. So if you're having a heart attack and you go on a commercial plane, you just get worse. If you're having a pulmonary embolism and you go into a commercial plane, you can easily get worse. You might need oxygen and the pilot might need to do an emergency landing basically so that you can be saved. It's life-threatening. So for him, one of the predisposing factors was definitely cancer, and that's why if you have pulmonary embolism or you have deep venous thrombosis, then we need to do age-appropriate cancer screening. For him already, he was recovering from stomach cancer, but the risk is still high, and that's why he was having pulmonary embolism. Later on, he continued on his journey to Kroger, which I've never been, but I hope to go, one day soon enough. But I lost touch with them. But I just hope wherever they are, he is doing well. But it was so grateful, and I'm grateful for my job because it exposes me to different cultures, different skin color. The uniting factor for all my patients is they just want to get better, go back home to their loved ones so that they can continue living their best life. It don't matter the color, it don't matter the religion, it don't matter where you're coming from. If you're sick, acutely sick, you just want to get better and go home. And this also highlights the importance of having health insurance while you're traveling, because some of these things are asymptomatic. You just collapse when you're connecting from one area to another, and you might end up in a very expensive hospital. The only saving grace will be your health insurance, because when you're traveling, you in some cities you're connecting, you don't know people, so you'll just be taken to any hospital, and if you have health insurance, then you'll be given good care. Or if you don't have insurance, you might need to pay cash, and we all know that that's very expensive. So watch out for my other video where I talk deeply about venous thromboembolism. An example of venous thromboembolism is deep venous thrombosis and pulmonary embolism. I'll tell you the difference, how to diagnose, treatment, how long treatment should go for. Thanks for listening to my talk. Yes, I did my nails.